The doctors were losing. The emergency room at St. Jude's Metropolitan Hospital was no different from a war zone. The symphony of despair was composed of wailing sirens, panicked shouts, and the incessant high-pitched alarms of medical equipment. An incident at the downtown subway station, initially announced as a simple gas leak, had devolved into a nightmare within hours. The arriving patients were crashing, one after another, in an inexplicable manner, and every attempted treatment was like pouring gasoline on a fire. They were calling it an industrial accident, but the symptoms didn't match anything in the medical textbooks. Dr. Eris Thorne, an idealistic and exhausted resident in his late 20s, ran from one patient to another, the weight of responsibility heavy on his shoulders. "Blood pressure is dropping, 80/50, a trainee shouted. Wiping the sweat from his brow, Eris rushed to the patient's side. "Give another unit of dopamine, prep for intubation." But deep down, he knew it would be futile. He had done the same thing for another patient 15 minutes earlier, and the result had been devastating. The chief of emergency medicine, Dr. Sterling, paced the floor with a tablet in hand, video conferencing with the city's top toxicologists. But even those brilliant minds on the screen were helpless. The seizures, the pinpoint pupils, the muscle fasciculations, followed by sudden respiratory failure. The combination makes no sense, a professor on the screen was saying. It's not a standard nerve agent. It's different, faster. In the midst of this chaos, Helena Vance went about her work like an unnoticed shadow. In her late 40s, with graying hair and a permanent look of fatigue on her face, she was a fixture at the hospital. The younger doctors saw her as someone who was just waiting for retirement, while her fellow nurses respected her unshakable calm under any circumstance. She was the invisible employee who followed orders without question and never complained. For 15 years, she had walked the same halls, listened to the sound of the same machines. But in that moment, something was different. As the gurney of a newly arrived patient passed her, Helena froze. She looked at the patient's trembling body, his nearly non-existent pupils, and most importantly, the faint geometric burn patterns on his skin. Then she leaned in slightly and did something no one else noticed. She smelled the patient's breath. That scent, a metallic mix of almonds and freshly cut grass. She knew this scent. She could never forget it. Her mind traveled back 10 years to another hell. A place not on the maps, where sandstorms and the smell of gunpowder mingled. She closed her eyes, then opened them. Her composure was unbroken, but her gaze had changed. She was no longer a tired nurse. She was looking with the sharpness of a decision made. She grabbed the arm of a young intern, Ben, who was rushing past, paralyzed with fear. Ben turned to her, surprised. For the first time in his life, Helena was going off protocol. She leaned into his ear and spoke in a whisper that would be lost in the ER's noise. "Sarin G. Get me the pralidoxim from the Strategic Disaster Reserve, and don't tell anyone." Ben's eyes widened in shock. "But Elena? That's locked. Only Chief Sterling has the authority, and did you say sarin? That's impossible." Elena's gaze was like steel. "Which is more impossible, that man dying or me being wrong?" I said, "Go." The young intern, for the first time in his life, had received an order from a nurse that was clearer than any from a chief physician. He hesitated for a moment, then nodded and ran towards the storage depot, trying to remain unseen. Helena, meanwhile, went to the most critical patient. The numbers on the monitor were dropping fast. They were the heart's last desperate flutters. Dr. Eris Thorne came to the patient's side with defibrillator paddles in hand. "Clear! I'm shocking!" he yelled. "It won't work," Helena said in a calm voice. For the first time that day, Aris truly looked at Elena's face. "What did you say, nurse?" "The shock will only strain the heart further. The problem isn't electrical, it's chemical. He can't control his muscles." Elena had already begun preparing a syringe and an IV kit for the antidote she was expecting the intern to bring. "What do you think you're doing?" Aris snapped. "Look at the patient's chart. We're following the standard poisoning protocol. Your job is to assist me, not to make your own diagnosis." Just then, Chief Sterling approached them. "What's going on here, Nurse Vance? Put those supplies down immediately." Elena did something she had never done in her life. She looked at both doctors and said, "No." Just one word. But it was a word spoken with the weight of decades. "Your protocol is killing people, because you're fighting the wrong enemy." Sterling's face turned crimson with rage. He was about to signal security when Ben ran up to them, out of breath. In his hand was a small military-style box with large red letters reading, "For use in disaster scenarios only." He handed the box to Elena. "This is it," Elena said to herself. Time seemed to slow down. She no longer heard the doctor's shouts or the machine's alarms. She had only one mission. She took a small vial from the box, drew its contents into the syringe, and injected it into the dying patient's IV line. "Are you aware of what you've just done?" Sterling roared. "You administered an unknown drug to a patient without authorization. This is the end of your career." Elena didn't answer. She didn't take her eyes off the monitor for a second. 10 seconds, 20 seconds, 30 seconds. The line indicating the heart rhythm had begun to flatten. A long, desperate beep filled the room. "We're losing him," Aris shouted. "Wait," Elena said. Her voice was hypnotically calm. And then something incredible happened. The flat line flickered for a moment. Then again, and again. A weak but regular sinus rhythm began to appear on the screen. The numbers indicating his blood pressure slowly started to rise. The patient's chest began to rise and fall more regularly. Everyone in the room was stunned. Dr. Sterling's mouth was agape. Dr. Aris Thorne looked from the monitor to the patient, then to Elena. There was no expression of triumph or relief on her face. Just the tired satisfaction of a job done. This wasn't a miracle. This was experience. In that moment, in the chaos of the ER, time bent for Elena, and her mind went back to a dusty, nameless desert outpost near the Syrian border 10 years ago. She wasn't a nurse there. She was Sergeant Vance, call sign Nightingale. Her job was to keep the soldiers of a Tier 1 Special Operations Unit, men whose very existence was a secret, alive. One day, the team she was with was ambushed, returning from an intelligence mission. The enemy hadn't used conventional weapons. A silent, colorless, odorless cloud of gas had brought the soldiers down one by one. Elena had seen the same symptoms that day: the pinpoint pupils, the uncontrolled muscle spasms, and that scent, the scent of almonds and freshly cut grass. Back then, it was an agent not written about in books, a new compound the enemy had developed called Sarin G. The standard atropine kits she had were useless. That day, she had watched her commander and 2 other soldiers die in her arms. But before he died, she had found the new antidote, pralidoxim, still in its testing phase, in one soldier's pack. She injected herself and the 3 other survivors. She had lost 6 men that day, but she had saved 3, and she had seared the chemical signature into her soul. The records of that operation were stamped top secret, the dead reported as having been killed in a training accident. And Elena, after the trauma she endured, had quietly left the army, swearing never to return to that world. Until today. "Do the rest of them," Dr. Sterling said. his voice a whisper mixed with awe and shock. His arrogance had given way to a desperate respect. Elena returned from the past. She nodded. "Get me 3 more nurses and 2 interns," she said, her voice now sounding like a command. "And bring me all the pralidoxim from the reserve. I'll adjust the dose for each patient according to their weight. Set up the decontamination tent. This damn thing is transdermal." For the next hour, command of the ER seemed to silently pass to Elena. She was no longer the nurse in the corner. She was a commander directing a battlefield. Doctors followed her directives without question. Nurses buzzed around her like bees. Elena went to each patient, assessed their condition, adjusted the dose, and moved to the next. With every life she saved, the 10-year burden on her shoulders felt a little lighter. Dr. Eris Thorne watched her from a corner, shame and admiration warring within him. While he had been trusting the latest technology and the newest protocols, this woman was trusting a wisdom not found in books, but learned through blood and loss. In that moment, he was learning the most important lesson of his medical career from an ER nurse. Sometimes, the most accurate diagnosis isn't found in the most advanced machine, but in the most experienced eyes. As the crisis slowly came under control, men in suits with serious faces began to arrive at the hospital. CDC, FBI, Homeland Security. They were all there to investigate the source of this mysterious chemical attack. But one of them was different. He didn't ask questions or take notes like the others. He just observed. This man, in his 40s, ordinary-looking in a gray suit, pulled Dr. Sterling aside. "I need to know who first identified the agent," he said. His voice was calm, but held an unquestionable authority. Sterling, without hesitation, pointed to Elena. "Nurse Vance. If it wasn't for her, we'd have dozens of casualties by now." The man moved through the crowd and approached Elena, who was cleaning her station as if nothing had happened, putting supplies back in their place. It was as if the chaos around her had just been a passing storm. She was once again becoming that quiet, invisible hospital employee. The man didn't use her name. He just whispered the word that no one had uttered in years. "Nightingale?" Elena's hands stopped for a moment. Her body went rigid. She slowly turned around and looked at the man's face. There was no surprise or fear in her eyes, just the tired expression of someone accepting their fate. "It's been a long time," the man said. "We need you to come with us. This wasn't an accident." The man gestured toward the chaos. "They're testing it again." Elena slowly nodded. She didn't ask anything. She didn't object. She just glanced back one time at one of the lives she had saved. Then she turned to the man and started to walk. She knew that some oaths are never forgotten, and some wars never end. Only the battlefield changes. Today, her battlefield had been a hospital corridor, and she, once again, had quietly done her duty. There was no victory to be told, only lives that were saved, and for her, that was worth everything.